Children are the future of our families and our nation. We thus owe it to them and ourselves to ensure that they are optimally supported, educated, nourished and protected, ultimately enabling them to lead their best adult lives and so contribute to the social and economic fabric of our nation and thereby its prosperity and survival. Our absolute duty of care to children relies on our societal, religious, political and legal systems to protect them from all forms of abuse and harm. This includes harm caused by ideologies that exploit the vulnerability of children for outcomes that are not in the best interests of the child and society. In this podcast, from the Let's Talk Medicine series brought to you by the Australian Doctors Federation, Dr. Louise Kirby, a general practitioner with highly relevant experience and knowledge, addresses the enormous risk posed to our children by an ideology-driven intervention that has been soundly rejected by leading medical practitioners and responsible governments internationally. Dr. Kirby's compelling scientific reasoning makes it absolutely clear that Australian children also must be provided with similar enduring protection as a matter of great urgency. I'm Dr. Chris Davis, physician and former parliamentarian, and I now encourage you to pay great attention to Dr. Kirby's every word so you can take your place in protecting our children and their future.
I'm Dr. Louise Kirby from the Australian Doctors Federation. We would like to call upon you to help us with a very important child protection issue. In recent years, there has been a large increase in the number of young children presenting with gender distress. Prior to 2009, the Melbourne Royal Children's Hospital was seeing 0 to 2 patients per year. By 2022, this reached 634 in 1 year. This is as a result of a complex interplay of causes including social media, a trans youth subculture, social contagion, and the promotion of the transgender ideology. It's important in this emotive area to keep to facts and evidence. Firstly, there are 2 biological sexes, male and female, which are fixed. No one can actually change sex. Medications and surgery make some changes to the body but can never result in the person being able to function fully as the opposite sex. According to the World Health Organization, gender refers to the characteristics of women, men, girls, and boys that are socially constructed. Historically, there were very small numbers of children with gender distress. After going through puberty, some realised they were lesbian, gay, or bisexual. The Australian National Association of Practising Psychiatrists, in its Gender Dysphoria Guide, states, "Childhood and adolescence is a time of rapid physical and psychosocial growth and profound personal development, during which young people may question their identity, sexual orientation and gender. As the child matures and progresses through puberty, this questioning usually transforms and resolves, and the young person, in the majority of cases, accepts his or her biological sex and adult body." It's important to look at what an ideology is and how this relates to gender. An ideology is a set of beliefs that tries to explain a human experience. It usually advocates for social action. It tries to recruit loyal adherents and sees the realization of its program as a struggle. In our society, we now have a transgender ideology. It is a set of ideas and beliefs that are not based on fact, reality, or science. The central idea in this ideology that some children are born in the wrong body is a made-up concept that is not true. The idea that these children should be given medication to stop their normal development, followed by hormones and surgery to try and change them to be the opposite sex, is not only impossible but very harmful. This ideology is causing irreversible damage to the bodies and brains of children and adolescents. Overseas, there have been studies and investigations into gender clinics, most notably in the United Kingdom, Sweden, and Finland. I will be referring numerous times in this discussion to findings from the Cass Review. Dr. Cass is a prominent paediatrician in the United Kingdom. She was commissioned by the NHS and conducted a comprehensive 4-year review of gender identity services. It included 8 independent systematic reviews of global research. It found there is no clear evidence base for gender affirmation interventions. I will now review the current affirmation model of care that is being used in Australia. Using this model, the idea is that if a child says they feel like they are actually in the wrong body and should be the opposite sex, this should be accepted. The child should go to a gender clinic where they can be prescribed puberty blockers, followed by cross-sex hormones, and ultimately may be referred for surgery. The guidelines used in Australian gender clinics are based on those from an organisation called OzPath. This is run by transgender ideologists and does not fulfil the peer review, evidence-based and scientific standards required to be used as guidelines. The UK Cass report also looked at international gender clinics and a review of clinical guidelines being used. None of the researchers recommended use of the 2018 Australian Standards of Care treatment guideline used by the Royal Children's Hospital in Melbourne. This guideline scored 19 out of 100. That's 19 out of 100 for the rigour of its development. It was judged untrustworthy by Professor Gordon Guyana, a pioneer of evidence-based medicine. So let's break down this model. We will begin with some actual science. The brain produces a hormone called gonadotrophin-releasing hormone. This stimulates the reproductive organs to release sex hormones, including estrogen and testosterone. Puberty-blocking drugs were originally developed for the rare occasion when some children commence puberty at a very young age. Unfortunately, in Holland in the 1990s, the idea came about that these drugs could be given to stop children with gender confusion going through puberty. The current gender affirmation model claims that this gives the child a pause to consider whether they want to then go on to cross-sex hormones. This is wrong in many ways. Firstly, how is a child who we don't consider mature enough to decide what they should eat for dinner, or vote, or drive, and who has no experience of their own sexuality, supposed to be able to make a decision about their future fertility, sexuality, physical and mental health? Studies have actually shown that the commencement of puberty blockers is not a pause, but an entry point into this damaging management pathway, with over 90% of these children then going on to cross-sex hormones. There are claims that these drugs are reversible and don't have side effects. This is also false. The American College of Pediatricians has the following as side effects of these medications. Puberty blockers can cause osteoporosis, mood disorders, seizures, cognitive impairment, and when combined with cross-sex hormones, sterility. Cross-sex hormones can lead to anxiety, depression, increased risk of heart attacks, strokes, diabetes, blood clots, and cancers across the lifespan. In Australia, puberty blocking drugs are being used what we call off-label, that is, for a group that is not included in the approved product information for that drug. They are being given to children aged 10 to 12. In fact, England's Cass Review also looked at international clinics and criticised Australian clinics for using an experimental fast-track path to puberty blockers for children as young as 8 to 9. The final step of surgery is almost too disturbing to contemplate. It is being performed on adolescents as young as 16 years of age. Concerningly, a parent on a transgender support site reported that there are surgeons willing to do double mastectomies on girls under 16 if they were referred from one of our children's hospitals. There are reports that the family court has judged transgender identifying girls aged 15 to be competent to consent to the removal of their healthy breasts. A study in Sweden over a period of 30 years found that there was a 19 times increase in the rate of suicide in those who had undergone cross-sex surgery. Another Swedish study found that sex-reassigned trans people had approximately 3 times higher risk of all-cause mortality than non-transsexuals. Mastectomies in girls forever takes away the ability to breastfeed in the future and leaves these young girls scarred physically and psychologically. Studies on female-to-male genital reconstruction surgery show complication rates of 64 to 70%. These include damage to the urethra and worsened mental health. A systematic review of male-to-female genital surgery showed an overall complication risk of 32.5%. Complications include fistula, stenosis, necrosis, and prolapse of what has been made to try and act as a vagina. A Dutch study also reported an adolescent dying of necrotizing fasciitis due to this surgery. Genital surgeries also affect sexual functioning, including the ability to orgasm. The following is a quote from the American College of Pediatricians. "I have removed the ages as they have been doing surgery on children even younger than in Australia." It states, "Physically healthy transgender-believing girls are being given double mastectomies and hysterectomies, while their male counterparts are referred for surgical castration and penectomies. And it becomes clear that affirming transition in children is about mutilating and sterilizing emotionally troubled youth." In terms of gender care overall, it states, "There is not a single long-term study to demonstrate the safety or efficacy of puberty blockers, cross-sex hormones, and surgeries for transgender-believing youth. This means that youth transition is experimental, and therefore parents cannot provide informed consent, nor can minors provide assent for these interventions. Moreover, the best long-term evidence we have among adults shows that medical interventions fail to reduce suicide." The claim that these treatments reduce suicide has been used to coerce parents into consenting their children for medical therapy. The catchphrase is, "better a live son than a dead daughter." This is a terrible manipulative strategy, as there is no evidence for this. The activists promoting this trans ideology and affirmative care have used the fear tactic of accusing anyone who disagrees as being transphobic. Unfortunately, this has resulted in the ideology being incorporated into our health, education, justice, and political systems. It has also been compared to homophobia. Homosexuality is an expression of one's sexuality. It is only by going through puberty that young people are able to determine their sexuality. In fact, this trans ideology is very harmful to young children destined to be homosexual adults, as they may be rendered sterile, with marked effects on their sexual function and harm to their physical bodies and mental state. The Lesbian, Gay, Bi Alliance Australia gives an excellent overview of the lack of evidence of benefit and the harms to young LGB people on its website, and states, "A core objective of LGBAA is to protect children who may grow up to be lesbian, gay, or bisexual. We believe young people including those who are gender non-conforming, deserve access to quality, evidence-based health care rather than care shaped by ideology. It then goes on to comment about the Cass review and gender-affirming interventions, saying, "The review found these interventions do not alleviate distress in those young people. Given the serious risks these interventions pose to children's physical and mental health, it is extraordinary that they have been permitted to continue for so long. Our goal is to end these practices throughout Australia and ensure that healthcare is grounded in robust evidence rather than ideology. We endorse the Queensland Government's decision to formally consider the growing international evidence against these approaches and to look to countries like the United Kingdom, Finland and Sweden, which are leading the way in ensuring evidence-based quality care." The Australian Doctors Federation agree wholeheartedly with that statement. There are also a significant proportion of children and adolescents with gender confusion who are on the autism spectrum. A United Kingdom study noted that 48% of children and young people seen in the Gender Identity Development Service scored in the mild to severe range on a score of autistic behaviours. There is frequently a history of trauma, sexual abuse, depression, anxiety, anorexia, or other complex mental health issues. The trans ideology, which promotes their model of care as solving the struggles these young people are experiencing, is taking advantage of these vulnerable children. There is also another aggressive mindset behind encouraging some children to become trans. Throughout the last century, there has been significant gains in accepting and allowing young people to break free of gender stereotypes and take part in activities that they are interested in and enjoy. The growth of women's sport has been wonderful. So if a child is what is now called gender non-conforming, this should be supported. These children should not be told that they are therefore the opposite sex and be put on a pathway of irreversible, harmful interventions. There is also now a growing number of young people who are detransitioning. They are struggling to get support and are being ignored by the transgender affirmation care supporters. The Australian National Association of Practising Psychiatrists Guide states, "Increasing numbers of individuals who have undergone hormonal treatment and surgical interventions subsequently report experiencing regret and a wish to detransition. They describe significant psychological and physical suffering, including loss of fertility and sexual function, as a consequence of decisions made when younger." So, in summary, there is no evidence that the treatments being used work. There is clear evidence of harm. The guidelines being used in Australia and promoted by our medical bodies that inform politicians are untrustworthy. The basis for this whole movement is an ideology that is not based on evidence or reality. Now, what should we be doing? Australian medical organisations need to stop ignoring the evidence from overseas, most importantly the 4-year Cass review. OSPATH guidelines should no longer be used. Puberty blockers, cross-sex hormones and gender-affirming surgery should be banned. Gender clinics need to close. We need to stop promoting this ideology in our health and education systems. As stated in the Australian National Association of Practising Psychiatrists, individualised psychosocial interventions, for example, psychoeducation, individual therapy, school-home liaison and family therapy, should be first-line treatments for young people with gender dysphoria or incongruence. I will briefly mention our education system. Preschool and school-aged children in some institutions are being taught to question their gender and consider whether they could be in the wrong body. Some teachers in Australian schools are socially transitioning children at times without the knowledge or consent of their parents. This is ideological indoctrination and is contributing to the confusion children are feeling. It increases the likelihood they will move on to the more harmful and irreversible medical treatments. It needs to stop. Any adult understands that children and adolescents change their minds and can get confused about complex issues. As adults, we have a role to protect our children from making decisions regarding their lives and health that could harm them. We have the greatest compassion for these confused young children and adolescents. We should be giving them emotional support and teaching them the critical ability of being able to sit with uncertainty and discomfort, which is an essential part of maturing into functional, resilient adults. The trans movement is full of props and promotion, thus the flags and the banners. It is an ideological movement that has infiltrated our society. There is no pot of gold for these young children at the end of the rainbow. The Australian Doctors Federation would like you to ask you, as concerned citizens, to support us in lobbying our government to end the harm being done to our children. We also have a very detailed podcast with 2 child psychiatrists, a paediatrician, general practitioner, and overseas expert, which I would encourage you to listen to if you need further information. For further information about the studies I have mentioned, you can go to the GenSpect Australia website. Please share this with your friends, colleagues, relatives, as our voices need to be heard for the sake of this young generation.